Sciatica sucks. As you go through this condition, there's a lot of severity to the spine where the nerves coming down the spine, down the legs, through the glute muscles can get compressed through multiple different channels. A lot of our lifestyle of sitting and compressing the spine over years and years makes this problem worse. But the more compression, the more compaction in that region will expedite the process of sciatica. So instead of teaching exercises to improve this, the whole goal is to spend the entire day doing healthy habits to minimize the stress on our spine and open up the space. So we're going to start with some activities to do from the time you wake up. Instead of stretching and things that pull on the muscle because we think to stretch the area, but when we deal with the nerve and sciatica, it's more about freeing the space and opening the pressure without pulling and tugging too hard. And that's a very important difference I want you guys to understand. So, pretend I'm getting up from waking. When you first wake up in the morning, your initial reaction is to jump out of bed. But sciatica causes a lot of pressure, and a lot of times you don't even realize until you first get up how much the stagnancy of lying in bed and relaxing and sleeping can actually stiffen up the structures of the joints and bones so that when you wake, you're actually feeling almost immobilized and can't even get out of bed. So instead of rushing out of bed, take this opportunity to do a nerve flossing activity. We just did a short about that, where instead of trying to stretch the muscle that can actually aggravate by pulling too hard, what you're gonna do instead is a lying nerve floss technique. What you do here is you gently bring your leg up. I like to bring the knee up first because you can't rush to bring the whole leg up when the condition is really bad. Grab the leg with support, slowly bring it up to 90 degrees. And now I'm going to slowly bend my foot up while finding what level is tolerable. You really don't want to push past a limit here, because what we're doing with nerve flossing is we're trying to create space and blood flow in the area rather than pull on it. Nerves in general, they're not like muscles where they're not elastic and can be stretched. Think of more like a frayed wire or a wire going through an electrical wire going through a tube where it needs to move and groove in that space, but it's not flexible in that same sense. So you bring the leg up gently with a 90-degree angle, bring the leg up, and then you're slowly trying to find that limit of how high and flexing and extending your foot. Plantar flexion, dorsiflexion, back and forth. You decide how fast to go. It's all about trying to feel the area loosen while you do this and get movement that will actually cause the muscles to gently move around that region as you're pumping. Then you bring the leg down, and even if you have, say, sciatica on one side, it's optimal and best practice to do it on both. The nerve endings exit the spine through the lower back, and they still can pull on one another from left to right foot. Maybe that hurt me too much, so I start lower. After a few, you can try and even test it and go up a little higher. But after you do just 10 pumps with both legs, now my back is more relaxed and ready to move. But I still don't want to just rush and strain here. The best way to get out of bed and off of a couch or anytime you're lying down is to turn your whole body. And by the way, when it's really bad, it helps to make sure the whole torso and lower body move together onto the side. You go all the way to the side first, and then you push to bring yourself up from the side. It's very important to do that way because maybe more guys and gals sometimes try to cheat where they'll hook the leg and pull and do half of the side maneuver to get up. That does not help. It's just as bad. You're straining the lower back while engaging these muscles. So instead of that, you take that extra second, you rotate, and you come up from the side, reducing the amount of stress on your lower back. Anytime you're getting into bed or out of bed in the morning, there's one other thing we can do to help really open up the space for sciatica. If I come around and say this is the edge of the bed, I'm gonna gently bring my body up a little bit so my torso is at the edge. I hold on and I slowly let my lower body sink down. What I'm trying to do is let gravity pull to decompress the spine. So instead of buying an expensive $300 inversion table, just use the bed, make sure you don't fall, but find out how much you're comfortable with. You can even bend the knees to help create more stability, but that also opens up the space in the lumbar, and you just hold and stretch for about 30 seconds to a minute. You can absolutely go up to 2 minutes, but at first, you need to be careful that you don't overdo it. I slowly rise while still having hand support. I feel pretty good. In fact, doing that technique right out of bed and right into bed is a great way to help minimize the stress that you get usually when you first wake up. So now I've gotten out of bed. I'm gonna walk, and in previous videos you may have seen the way we walk. You wanna have some swagger in your step. You wanna shift the hips and move the hips. You don't wanna just walk like a Frankenstein. You wanna pull the whole hip. I'm gonna go to brushing the teeth next. Next time you go to brush your teeth, always it helps to have support while you're putting one hand on the counter. It's not always easy when the counter's lower, but anytime you're at any sort of structure, high or low, that you have to bend over, that puts a lot of pressure on the lower back. I always find it helpful when you can to what's called stagger your stance. This is kind of the opposite what you would think of in the gym, where you want to always be taught to have your feet together, shoulder width apart. But in reality, what that does is it tightens up the lumbar muscles and erector spinae muscles and engages them more than they should. Not necessarily more than they should, but the problem here in sciatica and a lot of lower back pain is you don't have good core support from the inner core. And if you need more training on the inner core, watch our inner core video, because that's also part of it. With sciatica, you need to have strong inner muscles. But in this scenario, they're usually weak. And leaning forward with your legs like this will cause the outer muscles to tighten and pull and usually aggravate the discs and the sciatica. So instead, have a staggered stance or come from the side a little bit and try to have your hands somewhere to rest, so that when you lean forward, you have more support than just the lower spine that's under question right now. Another great thing you can do besides just the right positioning to help support your back is use this opportunity or another time during your standing routine to do another nerve flossing technique. What I can do is I can have my leg, I can bring it out in front of me and simply decide how far to lean forward. It doesn't have to be much. And I'm going to lean forward and again, try to gently pump my foot back and forth. The calf extension flexion seems simple, but as you're doing that, you're kind of pulling and moving muscle tissue and fluidity around the joint and nerve without aggravating it and pushing it beyond its means. So I do that a little bit to shake it off. I'm a little sore. Then I get back to brushing, staggered stance. And so anytime you're going about your day, you want to kind of follow those steps. Then when I go back to the bed, when I'm getting back to my nighttime routine, I want to do the same way of getting into bed. Carefully sit. I'm going to lie on the side and then turn onto the back. Now, the best possible ways to sleep for most people, everyone's a little bit different, is when you're on your back, you want a pillow, a thick pillow underneath your knees, or frankly, I find the thighs is more comfortable because that lift takes the pressure off the lower back. Anytime your back is flat, there's a natural arch in your lumbar, which is supposed to be there, but in this supine position, it puts excessive pressure on the discs. And for that same reason, when your knees are up a little bit, it relaxes the pressure and they can just settle down. The second best way you may know of is to be on your side with a pillow between the knees. Again, I find thighs is more comfortable, and it has to be the right size, because if it's too high, it will cause a lot of pressure at the SI joint. And if there's no pillow at all, just like if your leg was hanging, it pulls and pulls on that lower back and spine and causes a lot of stress later on. Use these strategies and keep looking at more of our techniques to try and add more to the routine to help sciatica. Look at the lower back video next. That will help the core stability we were talking about earlier, and that really is a vital piece of the puzzle.